The outbreak of monkeypox has taken scientists by surprise. Monkeypox cases have been identified in 15 nations outside West and Central Africa. The infection spreads through close contact and causes body sores like the one you're seeing on your screens now. Monkeypox is rarely fatal, but is today rapidly spreading in many countries. Belgium recently became the first country to announce a 3-week quarantine for persons infected with monkeypox. Some people are wrongly drawing comparisons between monkeypox and COVID-19. Some others are spreading fake news and propaganda and falsely calling it the gay man's disease. People infected with monkeypox are being discriminated against. And to top it all, once again, the question of access and equity is at the heart of the global monkeypox debate. Let's unbreak this news. Monkeypox was first identified in 1958 among monkeys in a Danish laboratory. However, the first human case was noticed in a child in the Democratic Republic of the Congo in 1970. Monkeypox is an infectious disease, which is caused by the monkeypox virus. The condition can occur in particular animals as well as humans. The symptoms of monkeypox start with fever, headache, muscle pains, swollen lymph nodes, and fatigue. And it soon develops into a rash that forms blisters in the body. According to the World Health Organization, since 13th May 2022, cases of monkeypox have been reported to WHO from 12 member states that are not endemic for monkeypox virus across 3 WHO regions. Epidemiological investigations are ongoing. However, reported cases thus far have no established travel links to endemic areas. Based on currently available information, cases have mainly but not exclusively been identified amongst men who have sex with men, MSM, seeking care in primary care and sexual health clinics. People affected by monkeypox are being discriminated against in many parts of the world. The disease is being wrongly highlighted on social media as the gay man's disease, which is completely baseless.
There's a lot of stigma and discrimination that surrounds many diseases. And I think the key thing we need to look out for is, as WHO, to work with our partners in communities and elsewhere to make sure that the messaging is correct. So while, for example, we're seeing some cases amongst men who have sex with men, this is not a gay disease, as some people in social media have attempted to label it. That's just not the case. Anybody can contract monkeypox through close contact.
Though monkeypox is rarely dangerous, its sudden spread has alerted nations. The World Health Organization has stated that it expects there will be many more cases of monkeypox in the coming days, as the international body has expanded its surveillance in non-endemic nations. Heads of various nations are now upping their surveillance to identify and contain the spread of the disease.
Quick question, what have your health advisors told you your level of concern should be about monkeypox and the cases that are in the United States and around the world?
Well, they haven't told me the level of exposure yet, but it is something that everybody should be concerned about. We're working on it hard to figure out what we do and what vaccine, if any, may be available for it. But it is a concern in the sense that if it were to spread, it's consequential.
Currently available evidence suggests that those who are most at risk are the ones who have had close physical contact with someone with monkeypox while they are symptomatic. According to the WHO, this disease could not have come at a worse time, especially when the world is going through a complex humanitarian crisis and COVID-19.
The pandemic is not the only crisis in our world. As we speak, our colleagues around the world are responding to outbreaks of Ebola in DRC, monkeypox and hepatitis of unknown cause, and complex humanitarian crisis in Afghanistan, Ethiopia, Somalia, South Sudan, the Syrian Arab Republic, Ukraine, and Yemen. We face a formidable convergence of disease, drought, famine, and war, fueled by climate change, inequity, and geopolitical rivalry.
Here are some of the key facts related to monkeypox. Monkeypox is usually a self-limited disease with the symptoms lasting from 2 to 4 weeks. In recent times, the case fatality ratio has been around 3 to 6%. Monkeypox virus is transmitted from one person to another by close contact with lesions, body fluids, respiratory droplets, and contaminated materials such as bedding. Vaccines used during the smallpox eradication program also provided protection against monkeypox. Newer vaccines have been developed, of which one has been approved for prevention of monkeypox. Since 1970, monkeypox has been reported in 11 African countries. In 1996, there was a monkeypox outbreak in the Democratic Republic of Congo. In 2003, the first monkeypox outbreak outside Africa was reported in the US. Since then, some occasional instances of the disease have been reported in some parts of the world. But this is for the first time the disease has spread across several countries at such an alarming rate. According to official data, the incubation period of monkeypox can range from 5 to 21 days. The febrile stage of the illness usually lasts 1 to 3 days with symptoms including fever, intense headache, lymphadenopathy, that's swelling of the lymph nodes, back pain, myalgia, that's muscle ache, and an intense asthenia, that's lack of energy. The febrile stage is followed by the skin eruption stage, lasting for 2 to 4 weeks. Lesions evolve from macules, that's lesions with a flat base, to papules, that's raised, firm, painful lesions, to vesicles, that's filled with clear fluid, to pustules, that's filled with pus, followed by scabs or crusts. Past research has shown that the vaccination against smallpox was 85% effective in preventing monkeypox. The disease outbreak once again has stoked a vaccine race. Like COVID-19 vaccines, reach, accessibility and equity seem to be the main concerns for monkeypox vaccines too.
There are products that are available, but they're not widely available yet. And we have an opportunity here to use these appropriately and to use these for those who are at risk. So we will be making recommendations on who, should be prioritized for this. This is not something that everybody needs. It is a virus that is spreading between people who are coming in close contact with those who are cases. And we really need to discuss, evidence-based use of these measures, access and equity. We really, as a global community, have another opportunity to do this right.
As more patients emerge with the symptoms of monkeypox, researchers are still unsure about the exact reasons behind the unusual spread of the disease. Racially insensitive and homophobic reportage on monkeypox by many media houses worldwide has spread more fear and panic about the disease than the actual disease itself. Several conspiracy theories being spread around monkeypox have all been proven to be wrong and misleading. For instance, some have wrongly gone on to claim that monkeypox is the new COVID-19. Others have bizarrely gone on to say that the monkeypox outbreak has something to do with Bill Gates. From calling it a hoax disease to labeling it as a condition caused by the COVID-19 vaccine, conspiracy theorists have been spreading misinformation against monkeypox and creating panic worldwide. Monkeypox is serious, but not as serious as COVID-19. But discrimination, misinformation and conspiracy theories surrounding the disease can only make monkeypox more dangerous than it actually is.